it says it's gone live. I just got it. I don't have to do anything else. Hello and welcome everyone. To everyone in the Better Bones community and Alkaline for Life, I'm sending a great big welcome. This is Dr. Susan Brown, and this is the springtime. In my mind, spring is a time for fun, for enjoyment, for enjoying nature and enjoying the resurgence of life. But spring is also the time of allergy, and that's because spring is a very humid time. It's a time when all the plants, the trees, and grasses are growing, and we're exposed to a lot of pollen and other substances we might react to. So today, I'm going to answer your questions on allergy, and I'm going to begin preparing you for a really special event we're going to have next Thursday. We're going to do a full community event on allergies where I'm going to give you an hour's presentation really understanding what allergy is and the 10 steps I use to correct my own allergies. We're going to do that next Thursday, and that is 7 o'clock Eastern time. And we're also offering a pre-event for those people that want to have me work with their individual case. We'll have an hour before that meeting. Well, I'll meet with people, see what they're working on, and an hour after the main meeting, we'll have an hour after with that group of people who want to work with me personally. We want spring to be really a time of fun, not so much a time of troublesome allergy. And I will tell you that I had very severe allergies years ago. And I learned to overcome them doing several things I learned from very smart people and very smart practitioners. And I'm going to share with you the 10 tips to overcoming allergy. That's next Thursday. Today, I'm going to answer your questions, so you can feel free if you have it. We have several questions that have been submitted, but feel free if you have other questions, just type them in the chat or send them to us, and we'll be sure to try to answer them today. Before we begin, I want to return to our theme, the theme that my team has about making everything we do this year be enjoyable as we move towards a level of better health. So we're doing the really interesting event on allergy next week, which will be fun and enjoyable, as well as informative. And we're going to Kerpalo to give the Better Bones Solution Retreat. That's a 4-day retreat. It's the Better Bones Solution where I teach every single step of the Better Bones program. We're going there actually May 18th. It's a 3-4-day event. So we hope you'll consider that. That's a wonderful opportunity to learn from me firsthand and from my staff and from Gina and all the people that work with us how to maximize your bone health in 2023 and maximize it forever. In addition, we have great news that at Kerpalo or at that event, we've arranged to have Dr. Andy Bush and the Echo Light machine there. So if people want to have a meeting with him and get their Echo Light bone density reading, which is also a test that measures bone fragility, we can do it there at that event in Massachusetts. So if you're interested in getting an Echo Light test and interested in attending our Better Bones retreat, which is a live retreat, we're delighted to get back to the live retreats because you know what? These retreats are a chance to create wellness. It's like a wellness adventure. Like it's a wellness workshop. It's kind of a fun way to learn some things, to set your program for maximizing your health, but in a lovely, uplifting environment with delicious foods, a delicious setting, and wonderful people to be around while you also learn every step of the Better Bones Solution. So that is May 18th. I hope you join us. It's going to be a great event. And finally, the last really fun thing, we've decided we have to expand our horizon. So Gina, with the Exercise Evolution, has organized a trip to Costa Rica next February. We can take about 20 people with us who want to learn about building their bone health with exercise. And I'll also be lecturing a bit some of my inside tips, but it'll be a great opportunity to vacation for wellness in a beautiful setting in Costa Rica. So because we can only take a few people to this particular event, you might want to sign up soon if you're interested. It's going to be a lot of fun, and that's going to be February 2024. Okay, so let me get to the questions. We have several questions about allergy, and I'm going to start out just the top of the ones that were mentioned. But I would tell you that everything I'm going to discuss pertains to seasonal allergies, but it also pertains to food sensitivities and to chemical sensitivities. I myself had many chemical sensitivities. In fact, I would, when I drove into Los Angeles to work, I would have to wear a mask, a serious mask. When I flew on airplanes, I would get terribly sick because in those days there was a lot of smoke, a lot of exhaust. We want to know that any allergic response you have, this program I'm talking about, these tips will be helpful for you. And we're going to go into that a lot next Thursday at the major community event. But today I'm going to answer these particular questions. So this first question is from Casey. She said, my fiance has psoriasis and also bad allergies. Now, psoriasis is an autoimmune disease. So we know with psoriasis, the immune system is overwhelmed. And we know with allergies, the immune system is overwhelmed. As I'm going to teach you next week, if your immune system is resilient and not overwhelmed, you can just soak up any allergen, any wheat, pollen, any foreign material that gets into the blood. The immune system can just soak it up gently. But when you're overwhelmed, then you develop autoimmune disease and you tend to develop allergies. She says, are there any vitamins that he's lacking that could cause psoriasis? So when you have an autoimmune disease, you really want to reduce burden on the immune system, but you also want to find out what you're reacting to. And you want to, of course, heal the gut, and you want to, of course, have all the essential nutrients for building new tissue on a daily basis. So with psoriasis, I'd say you always want a very professional grade product because people can react even to a filler or binder. So you might start out with that multivitamin, the Energize Multi, which is a professional grade multivitamin developed by a scientist who really dedicated his life to autoimmune disease. So that's a very perfect formula. You might do 3 or 4 of those a day. And of course, you want to deal with the anti-inflammatory nutrients, the same kind of thing I'm going to talk about today. The major repair nutrient that I've seen over all the work I've done is a buffered ascorbate, a very particular type of vitamin C, which is buffered. And it's the form of vitamin C that the body uses. And being buffered, it also offers a certain amount of minerals to the body. And then, of course, if you talk about psoriasis, we're talking about quercetin. Quercetin dehydrate, especially if it's combined with pomegranate and OPC, is really the major anti-inflammatory, and it works very well with vitamin C. They're like companions. It's like the orange part of the orange has the vitamin C and the white part has those flavonoids, and that's the quercetin, the pomegranate OPC formula. So, your partner could well have many nutrients that he needs to attend to. And the psoriasis, Casey is asking me, does psoriasis, is it coincidental with the allergies? And I'd say yes, they're both signs that we need to bolster the immune system and reduce the burden on the immune system. So be sure to have your partner listen to the community event I'm going to give next week, an hour-long discussion of allergies, what they really mean and how to overcome them. And certainly, the choice of foods is really important. And I'm going to show you a test next week that can be done, a very elegant test to detect which foods and chemicals are actually leaking through the gut and getting into the immune system and making the autoimmune disease worse. So that's really great. So everything I say right now for allergy, it would be great for your partner with psoriasis. And certainly there's more even you'd want to do with psoriasis, because psoriasis is a very significant disorder where the body is attacking itself. Okay, so Kim writes, Do you take the vitamin C and quercetin regularly to prevent allergies and sinus problems? I'm allergic to trees, grass, dust, etc. And I get sinus migraine roughly every 6 weeks that lasts for 3 days. So Kim, yeah, you have a really kind of a significant but really clear problem that your immune system, too many particles are leaking through the gut, leaking through even the lungs, even through what the substances that we swallow, the dust and all that. And that's causing enough allergies to burden the immune system. So you're actually getting inflammatory, these migraines every 6 weeks that takes 3 days to clear. And then you wrote, I used quercetin and liquid vitamin C when I had COVID, and I had the least symptoms of anyone. I had a runny nose and a cough that only lasted 3 days. And you mentioned even though you were at high risk. So what you're saying, Kim, is I've got these wicked allergies. I often end up with a migraine. I've got sinus that when it accumulates, I get a migraine. Everything I'm going to show you in this workshop on Thursday is going to help you. Certainly you discovered yourself one important key, which is the vitamin C. The vitamin C, which is really the number one antioxidant and a great antihistamine. And quercetin is the most effective natural antihistamine, particularly quercetin dehydrate when it's combined synergistically with this pomegranate juice, which is another classic immune boosting agent that's been studied, that's been used for thousands of years. It's highly mentioned in the Bible. It's a very important series of antioxidants found in pomegranate. So the vitamin C, pomegranate, you're on the right track. And that use the same, the protocol you use for COVID, to prevent COVID, use it for your allergy. And I'm going to teach you that there is a science of using vitamin C to tolerance as much as you can take without getting too much loose stool. So that's why we offer a very refined powdered vitamin C that's totally active, that is buffered so it's not unpleasant to take. And you take maybe a teaspoon 5, 6, 7 times a day until a point where you're getting too much loose stool. And you use that together with the quercetin, particularly the quercetin pomegranate formula, which we call Relieve and Repair. You will find you have much lower allergies. And I'm going to give you many other tips as we go along on this course Thursday, but you're on the right track. You prevented COVID from getting serious. You can prevent your allergies. And we're going to talk about diet. I mean, diet is very important. Do an anti-inflammatory diet. And what's the anti-inflammatory diet? The easiest guide is the Alkaline for Life diet. I've written much on it. We have a whole webinar on it. Start getting more of those fruits, vegetables, nuts, and seeds. Start measuring your pH. You can get your chemistry in a really healing position to make yourself kind of bulletproof to allergy, let's say. So the next question is, this is kind of interesting. Yin Lu writes, leaky gut is the root cause of all evils. This seems to be her her quote. She puts it in quotation marks. Leaky gut is the root of all evils. Do you have a comprehensive strategy how to cure leaky gut? Well, you're absolutely right. The gut is the new frontier. We find that the microbiome in our gut affect everything from how we think to how we produce hormones, and certainly to how we digest food. And the microbiome can control this issue of leaky gut. It's interesting that the gut is in the intestine. A lot of strange things happen, and you don't want a lot of those strange things getting into the blood. And so there's a barrier in the gut, and that barrier is, they say, is just one cell thick. And that barrier, if that barrier is healthy, those little particles that you don't digest well, or those little pollens you swallow, are not going to leak through the gut and get into the bloodstream. We want to keep these things out of the bloodstream. So indeed, a leaky gut is a big problem. And the way you begin to correct that is, number one, you get all the nutrients that help to make the gut healthy. These are all your basic vitamins and minerals. You know, it's not that just one nutrient is important for the gut. The zinc, manganese, copper, the same things that are good for bone are excellent for the gut. You need all the basic nutrients. That's why we say to everyone, use the high quality, professional grade, allergy-free multivitamin like the Energize Multi we have. And then you want to make sure that you're not taking substances that damage the gut, like so many medications actually damage the gut. Antibiotics, for example, is one of the major causes of leaky gut because the antibiotics kill the bad bacteria, but they also kill the good bacteria. And people begin to develop things like candida. Candida itself damages the gut, and you can develop leaky gut from that. So you start saying, okay, am I doing things inadvertently, like with medications that damage the gut? And now there is such a capacity for each individual to do their own research. So you take your medicine and you do a little search on Google, or better yet on PubMed, and say, and look, how does this particular drug affect my gut? And you'll find research on it. So we want to avoid things that are damaging the gut in that way. The same thing, leaky gut, is very related to poor digestion, because what leaks through the gut that becomes a problem are larger particles of undigested protein. So we go right back to the principle of how we eat. And I'm going to talk about this in Thursday's session, about some simple lifestyle practices like eating carefully and chewing the food carefully. That can make a really big difference, and eating in a peaceful environment. I'll tell you something interesting. You might have noticed I tend to be kind of a speedy type of person. Well, if I am in a rush and I eat standing up, I will get indigestion. But if I eat that same food sitting down, taking a few minutes to do it, I don't get indigestion. So how we eat is almost as important as what we eat. What we eat can also cause leaky gut. You need to have foods you digest well, because if you don't digest them well, they're going to be large particles floating around the intestine. And if you have a leaky gut, they're going to get into the bloodstream. So, and then of course, it's good to test for pathogens. If you have a serious leaky gut, there's many tests like GI map, and there's many particular nutrient protocols to heal the gut. We, of course, like ascorbate. That's our number one. We, of course, like quercetin. We like everything in a multivitamin: manganese, zinc, copper. The multivitamin we use is 40 nutrients in the most bioavailable form. You want all of those. And then you want to think about things like glutamine, but you want a glutamine that is recycled in such a way that you don't have to use a lot of it. And we can tell you more about that product. My team is actually producing a product that's going to be a high quality glutamine to help heal the gut. So there's lots to come with that, but start out with these simple suggestions. You're absolutely right that leaky gut is really at the root of many, many problems, and particularly of allergy. Suzanne writes, if you have, let me see, this print is kind of small. If you have had bad allergies since birth, does this mean bone health has been impacted by that? Well, every case is different, but we certainly know that allergies mean that the immune system is overwhelmed. And one thing to remember about the immune system is the immune system is like your circulating intelligence. Your immune system is like bits of your mind, your intelligence, that are running through the body, looking. The immune system does three things. One of them is to defend from foreign invaders. So part of the immune system is going around looking what's in the blood that shouldn't be here. An allergy is when something is there that shouldn't be there, that's not particularly harmful, like a little bit of dust or pollen or a fragment of undigested protein, but the immune system gets really excited about destroying that and uses a lot of chemicals to do that, like histamines, that cause this inflammation. It's overwhelming of the immune system that it gets hyperactive and attacks things that it maybe doesn't have to attack. The second thing the immune system does is it repairs the body. It directs repair. And so this relates to your question about bone. If the immune system is so busy fighting against allergy that it does not have time to direct the repair, or it says repair is not as important as the immediate threat of all these unwanted particles floating around the blood. So when we deal with allergies, we help relieve the burden on the immune system so it can repair the body. To answer your question about bone, well, you could say, sure, it hasn't helped your bone that you've had allergies your whole life, but it doesn't do any good for us to look backward. We say, okay, I'm going to deal with my allergy right now. And that's also going to help me have overall better health and free up my immune system and my gut actually to repair, to go under the, to get in the process of repair. Repair is the key issue. And much of what I'm talking about, much of the health problems we see today are repair deficit. The body does not have the nutrients or the correct environment or even the emotional setting or the pH to conduct full-scale repair. So yeah, don't worry about it. Don't worry about it. But if you correct the allergies, your bone's going to be better. That is for sure. And try to just move forward. Don't worry about what you've done in the past. Astrid says, I read about pink algae turning on the osteoblast. Is it true? Well, you know, this is very interesting because I'm proud to say that for 30 years, I've been teaching people that bone health relates to every single nutrient you could possibly get in the body. And when I produced my formulas for bone, I included all the nutrients, at least the 20 key bone nutrients that are essential for bone. And these are, many of them are minerals and many of them are trace minerals. And this thing with this algae, this pink algae as they're calling it, has been researched with animals. And what they find is that it's the trace minerals in this algae that seems to help the bone and helps to stimulate the osteoblast. Now, I have been saying this for a long, long time that we need all of these minerals. And it's the same thing. You need all these minerals. And one of the minerals they've pointed up in this, you know, you got manganese, zinc, copper, and they also found that there was a small amount of strontium. And so strontium is important in small amounts, but we're not talking about drug therapy, high dose strontium. We're talking about as a part of a multi-nutrient, very low potency for bone. This is interesting to me, this study, and I have it right here on the pink algae. The important thing about it is trace minerals. And this is one thing we've called attention to for decades now. And I hope everyone is getting all their manganese, zinc, copper, boron, either through the Better Bones Builder or through our alkalizing minerals. That's very important. So I wouldn't run around trying to buy pink algae, but I would go back and get all those minerals and eat as much fresh whole food as I could. That's extremely important. And those minerals will also help set the pH. Because remember, what turns on osteoblasts is having abundant antioxidants, having a very good pH valence. We see all these plant compounds that like green tea is great to turn on osteoblasts, and curcumin and quercetin is highly studied to turn on osteoblasts. So don't get carried away with any one new thing like algae, because that is a research project saying that the minerals, trace minerals are important, are the most important. Get all of your bone building nutrients. Don't think it's just one single nutrient. Then here, the next question is that the next question pertains to, let me just make sure I've got them all straight. I don't want to miss some of these questions that came in before. Okay, the next question pertains, now Christine writes, well, let me start at the top. I have mild pulmonary sarcoidosis. Will sarcoidosis affect my bone health? Now, Christine, the thing to remember about sarcoidosis in bone is that sarcoidosis is, again, one of these autoimmune disease, and it's a little bit tricky in that it can cause you to produce high levels of vitamin D. So, you know, we're always saying vitamin D is important for bone health, but if you have sarcoidosis, you want to have you don't want to use vitamin D supplements unless your doctor has tested your vitamin D level, the regular vitamin D level, the 25 OHD, but which is a test for vitamin D adequacy, but there is also a test for the vitamin D hormone. which is called 125 OHD. So you want your doctor to test for the vitamin D hormone, because in sarcoidosis, the body can produce too much of that, and it can be a problem. So please don't take vitamin D, Christine, until you talk to your pulmonologist or your doctor who does this autoimmune disease to make sure your vitamin D hormone level is not too high. That being said, any autoimmune disease is going to put a little burden on the body to repair itself. And so I would say right away, Christine, that you want to consider a comprehensive program to deal with autoimmune disease. And the program I use is the program by Dr. Russell Jaffe. It's called the ELISA Act Biotechnologies. We're going to talk about it more Thursday, but it's the program I use for autoimmune disease. My assistants can give you the number, and you can consider doing a comprehensive program, finding out, using particular tests to find out what foods and chemicals are adding to your autoimmune burden, and dealing in a profound way to recover autoimmune strength. But in the meantime, be careful with the vitamin D, and don't worry about your bone. If you can do all the steps of our program, like if you can do the exercise, you can do the alkaline, you can measure your pH, you can get the nutrients, and certainly all kinds of meditations and breathing exercises will help you. So I would deal with the sarcoidosis first, and if you do a good program for sarcoidosis, you can easily integrate our bone program. Just watch with the vitamin D. Jeannie writes, does vitamin C need to be taken with quercetin at the same time? That's a great question. When we eat certain foods, they have, like an orange, it has vitamin C and it has the flavonoids. Quercetin is a flavonoid, vitamin C is in the orange, but you don't need to take them together. I personally do take them together. Every time I take a teaspoon of vitamin C powder of this, you see, there's all kinds of products. You can buy a vitamin C powder that's already oxidized, that's already been exposed to air or light. We only use very triple purified vitamin C that's packed under nitrogen, so it's very potent. All of its electrons are in place to donate those electrons as an antioxidant. So I take a teaspoon of vitamin C, and you might start with a half a teaspoon. I take a quercetin, this Repair and Relieve, which is a quercetin complex. You always want quercetin dehydrate. There's other types of quercetin that aren't as great, that aren't as usable by the body, and may even be a problem. So we only use quercetin dehydrate, and we use it with OPC and pomegranate, so you have a synergistic effect. Take them together is fine. Like I'm right now in Oregon, and when I leave here, you can bet on the airplane I'm going to have vitamin C and quercetin just in case somebody's got a big perfume next to me, or there's something going on that's causing inflammation. Take them together, take them apart, they're both fine. She continues to write, for hay fever, I was told antihistamines and has a negative impact. And that's right. One of the things I'm going to talk about in the Thursday session is why you want to take the trouble to correct these allergies. And not just take a simple solution. When I was much younger and had all these allergies, I just took antihistamines, decongestants all the time. I had stomach pains from them, but I was able to get rid of my sinus and my headaches, constant headaches. But now I know that that wasn't a great idea, because you look back and these things can cause everything from leaky gut to dementia. So I'm not really, I'm trying to save you from having to go through all of that. I wasn't smart enough way back then to actually avoid these things, but now I know how to help avoid them. I've avoided them myself, and I can show you not a good idea to take these things. And I'll detail each one of the antihistamines, the decongestants, certainly steroids. They have a lot of negative effects. She writes, I'm taking quercetin 3 a day, but the relief is less than 1/2 the Zyrtec. Okay, so she says it's less than half a Zyrtec or a Clarinex. So which should I do? Okay, here's my position, and here's the position of the Better Bones team and the Alkaline for Life team. We want to actually enhance natural functioning. If we take things like vitamin C and quercetin, these are concentrated food factors that actually help repair the body. We do not suppress the symptom deeper. We correct the symptom by enabling the body. If you take a drug, it's going to stop the symptom, but it's going to drive that disorder deeper. In fact, all these like Zyrtec and Clarinex are shown to cause dependency because a person, the effect wears off and a person becomes dependent on it. So you not only have the negative effect, the drying of the mouth, the chance of increase in dementia as you get older, many other things we'll talk about on Thursday, but you actually end up using more of it. So bite the bullet. First thing you all want to do this is a time of pollens, and tree pollens cross-react with gluten. So the first thing is go off the gluten, limit the dairy. Dairy is another thing that's very, very congesting. Anything that causes mucus in your body, take the vitamin C and quercetin because it's going to be good for all of you. What we try to do and what I'm suggesting you do, anything you use, make it good for your entire body, if at all possible. Okay. So, and don't say, well, it's taking me 4 quercetins and 3 teaspoons of vitamin C and I could do 1 Zyrtec. Well, the choice is yours. But if you want to enable your total body health and over the long term, I'm here now working with people. I've traveled to work with some people in Oregon who have negative impacts of long-term drug therapy. And you want to be really careful to look at that and say, let me solve the problem now if I can, instead of covering it up to any extent you can. And the functional medicine doctors, the naturopathic doctors, they're all thinking the same way. So Sullivan writes, is vitamin C, liposomal vitamin C, the best type for absorption? Lipovitamin C is an interesting type of vitamin C that is the vitamin C, the ascorbic acid, is attached to a liposome, which is like a fat molecule, and it's a perfectly fine to use it. It's not necessarily the best absorbed. I think the best absorbed is the buffered ascorbate formula that we use. And the trick of it is that the liposomal only delivers so much vitamin C because it's got a lot of liposome in that. And so you have to take many, many of those capsules to get the equivalent of, say, 1 teaspoon of the powder of the alkalinity C. So, if it's working for you, fine. But if you say, I'm having to take too many tablets or too expensive, certainly look at the alkalinity C. Vitamin C is a key, really a key. And there are many forms of it, but you want one that's very potent, and certainly liposomal C can be effective, but it's not really made for high dose therapy. Okie doke. Well, this has been a lot of fun, and I hope that it was useful to you, and I hope you'll think about seeing allergy as a sign that the body is saying, hey, I need some help here. I need to repair myself, and I want you to remove some of the burdens to repairing myself, whether that be resting more, whether that be drinking more water, whether that going off that things that cause congestion. The springtime is a time of a lot of moisture. It's a lot of humidity, a lot of dampness, and it's kind of cold. So it's a good time. We want to warm up. We want to have nice hot cooked food. We want to avoid the cold things, cold environments and cold food. And you want to do the nutrients that allow for repair. And finally, the pH balance is extremely important. And if you say, I wonder if I have enough minerals to actually heal my bone and fuel the immune system, we know that if you look at our alkaline diet and our alkaline diet starter kit, get that little kit, get the book I wrote on pH, and look at the first morning urine, because that will reveal a great deal about your mineral status. If you're low if your first morning urine is not 6.5 to 7.5, you are not giving your body everything it needs to heal from allergy. And the neat thing is, these same nutrients that are going to heal from allergy are going to help build bone and build your overall body strength. So all of it ties together. I think we're pretty much set. I look forward to seeing you all Thursday at the great community event on allergy, so that each of us can enjoy the spring and not be so burdened with allergies and move on to have great health during this coming year. So I wish you well. I will talk to you all Thursday. Have a great Easter. And